Dr. Joseph Harmon has been in the biz of strengthening smiles for more than 40 years. For him and others who do the same work, as important as perfecting pearly whites is stopping the spread of germs. How they do that has changed a lot over time.
Pre-1991, before the mandates, we basically didn't sterilize our handpieces. A lot of dentists didn't wear gloves. We cold sterilized and didn't steam autoclave things. Post 1991, we did a lot of those things, and we got a lot of disposables where we throw things away. We use plastic, more disposables. We sterilize our drills with steam autoclave, which is high heat and pressure.
30 years later, in the days of COVID-19, it's changing even more. The virus has heightened their awareness of dental aerosols, the liquid particles that come out of patients' mouths while they're laying in this chair. It's not obvious when the light's on, but look at what you can see when we turn the light off.
We were aware of aerosols. I mean, we wear masks and things like that. We sterilized, we wiped down the rooms with a disinfectant and that kind of thing. However, we really didn't manage the aerosol that was floating around in the room. I don't think anyone did. We suctioned with high-speed intraoral suction. However, that didn't get all the aerosols. However, we just kind of, and we didn't do anything about it. Now we're managing aerosols, which is it's a kind of exciting in a way.
They're doing that using a few different tools. One for intraoral high-speed evacuation.
Well, we have to suction so you don't drown when we're working on it.
One for extraoral high-speed evacuation. That'll catch what escapes the mouth.
And if it suctions anything that gets out, it keeps stuff from floating around.
And if anything does end up floating around, they've got air purifiers which turn a room over in 2 minutes.
So you can be assured that room is cleaner than any room you probably will ever go to.
Dr. Harmon says aerosol particles are different weights, which will impact how long they float.
It's kind of like a swimming pool. The heavier, the more it sinks. So the smaller the particles, the more they float around.
Also, the smaller the particles, the further they'll get into the body.
Anything that's, say, 10 microns like pollen, okay, is going to go into your sinus and your nose. It's not going to go in your lungs. But when you start getting down to 1 micron or even like less than 5 microns, it's going to go all the way down in your lungs. So it's the size particle has to do with how far a virus would contaminate you.
Dr. Harmon says this technology is more than the new norm. It's here for good.
It is for us because I think it's the right thing to do.
Adios aerosols. Hello, happy, healthy smiles.